So today I'm going to talk about multifocal atrial tachycardia and then two herbs, Dan Shen and Mu Dan Pi, which work together in combination. And we'll take a look at an example of how it can be used in treatment for multifocal atrial tachycardia. Multifocal atrial tachycardia is a type of atrial arrhythmia. More specifically, it's what we call a supraventricular tachycardia. So if you think about the heart, you have the lower chambers, which is the ventricles, and then the upper chambers, which is the atrium. And when we say supraventricular, we're talking about above the ventricles. So it's a arrhythmia that comes from the upper chambers of the heart, and that's just kind of a big picture understanding of supraventricular tachycardias. Now, usually when we talk about the heart's electrical activity, it focuses and it comes from a specific point, the SA node, and it comes down to the atrioventricular node, and it moves in a symmetrical, well, not a symmetrical, but a coordinated, that's probably a better way to say it, a coordinated manner throughout the heart, and it goes in a coordinated manner so that the atrium and the ventricles contract in a coordinated manner, and you get the maximum amount of blood flow that you can. And so what helps the muscles have that nice smooth movement is the electrical activity moving smoothly through the atrium and through the ventricles. So when we have multifocal atrial tachycardia, what we're having is actually, instead of one spot in the heart where the electrical activity is starting, it's actually starting in lots of different areas. And because it's starting in lots of different areas, you have the movement of the heart and the atrium just contracting at different times in different places, and you don't get good blood flow through the atrium. And so multifocal atrial tachycardia is a type of supraventricular tachycardia. Probably one of the most common ones that most people know of is atrial fibrillation, or AFib. And this is also an atrial tachycardia, but it's a different type of it. And we usually diagnose and differentiate different arrhythmias of the heart based on the EKG, because the EKG is what reflects the electrical activity in the heart. So so that's a little bit about multifocal atrial tachycardia, and it's not a easy disease to understand conceptually, unless if you have it, then you've probably read a bit about it and you have a better idea of how it works. But for the average person, it can be a little difficult to conceptualize. But that's just a big picture overview. What I wanted to talk about was a couple of herbs in Chinese medicine, which could be used if the scenario is right. Now, in Chinese medicine, we don't just do one herb for one type of medical condition. It's not that you get a diagnosis of multifocal atrial tachycardia and therefore you're going to get these two herbs. It never works like that. Basically, you have to be evaluated, and if the signs and symptoms match, and if we evaluate you and you have in Chinese medicine certain diagnostic findings, then we give you certain types of herbs. And so the two herbs, Nanshan and Mudanpi, these are both actually cooling herbs, and they're herbs that can help to what we call move the blood, and it can help to prevent the blood from stagnating. And sometimes when people have heat in the blood, it can result in atrial arrhythmias. Now, some people may not have heat in the blood. They may have cold in the blood causing atrial tachycardias, in which case this would be the exact opposite of what you would want to take. And so it's not just yeah, this is what you have and this is the herb you're going to take for it. You really need to diagnose whether there's blood heat, there's heat in the blood, whether there's stasis in the blood, where that stasis is located. Now, both Danshen and Mudanpi are herbs that they do go to the heart. They go to a number of different organs, the heart, the liver, the kidneys, but both of them together do enter into what we refer to as the heart channel in Chinese medicine. And Shen is a herb that it's a cool herb, and it focuses more on actually moving the blood and what we call invigorating the blood and preventing stasis. And it secondarily helps to nourish the blood. Mudan Pi, on the other hand, is an herb that first of all focuses on cooling the blood, and then secondarily it can also invigorate the blood, but its primary focus is to cool the blood. So both of these herbs together can do very well to treat states where you have both heat in the blood and blood stasis, or any sort of bleeding disorders. Even this would be a good combination for it. So multifocal atrial tachycardia, and then if you also do have heat in the blood with blood stasis, then Shen, Mudan Pi are a good combination for that. And we'll see you next time.